Two new articles in the New England Journal of Medicine provide some bad news and maybe some good news for fatty liver disease. Does this apply to you? Well, if you've had elevated of your liver function test or been diagnosed with fatty liver disease, absolutely this applies to you. If you've had type 2 diabetes or insulin resistance or overweight with abdominal obesity, it may apply to you because people with those characteristics are more likely to go on to develop fatty liver. So this could be pretty pertinent information, but the bigger overall question for me are why are we even discussing prognosis and medications when it's something that can be prevented and treated with lifestyle alone? Let's get into some of the specifics here. I'm Dr. Brett Scher, the medical director of DietDoctor.com, and I got this in the mail the other day, the latest New England Journal of Medicine, and it just caught my eye that there were these two studies of fatty liver. So fatty liver, quick review, it's where your liver literally fills up with fat, and it's not supposed to have much fat at all. Now, it used to be it only happened with alcoholics, that people were just drinking so much alcohol that alcohol and the sugar from the alcohol was just converted to fat and stored in the liver, and they would have liver failure and have very bad health consequences, even death and need for liver transplantation in some people. But as this obesity and type 2 diabetes and metabolic disease epidemic increased, so did a new type of fatty liver disease that was unassociated with alcohol. So it was called non-alcoholic fatty liver disease, or now NAFLD is one, NAFLD, or NASH, non-alcoholic steatohepatitis. There are a lot of different names. But the key being non-alcoholic, which I think is terrible to even name it that, because rather than say what it's not, we need to say what it is. It's metabolic disease. It's insulin resistance. It's obesity and abdominal obesity and visceral adipose related. So it'd more likely be metabolic fatty liver disease is probably a better term. But regardless, the first study looked at prospective data following people with non-alcoholic steatohepatitis, fatty liver, for 4 years. And what they found was that the rate of death or severe complication from liver failure increased with the amount of fibrosis. And that makes sense because fibrosis is sort of the scarring and the irreversible damage to the liver. So if you had stage 0 or 1 fibrosis, your chances of dying or developing severe complications were significantly less than if you had stage 3 or 4 fibrosis. Okay, not earth-shattering, makes sense. The worse your liver disease is, the worse your outcomes. That makes sense, but they were pretty bad outcomes. So the question then should become, well, how do we prevent that progression? Just knowing that that's the case isn't enough. We need to know how to prevent the progression. If someone already has fatty liver, how do you prevent them from going from stage 0 to stage 3? And, well, then there was another article called a randomized controlled trial of the pan-PPAR agonist lanifibranor, I don't even know if I pronounced that right, in non-alcoholic steatohepatitis. So it's a drug that's basically this PPAR, what's called a PPAR agonist. And I guess the point is not to get into the mechanism of the drug or how it works, but it definitely, in this 24-week study, it reduced the progression of fibrosis by at least one stage in 48% of the people at the high dose, 34% of people in the medium dose, and 29% of the people had that same outcome with placebo. So, it was about, I guess, 1.5 times better, the 48% versus 29%, something like that. So it showed a progression. Now, as I'm reading this, I'm thinking, okay, that's interesting that they have a medication to do this for a completely lifestyle-related disease. This isn't a cancer that you get that you don't know why you got it, right? This isn't some autoimmune condition that maybe you had no control over or a genetic condition that you were born with. This is a lifestyle disease. And sure, genetics may make you more prone to it, but it's clearly the lifestyle that's triggering it. And so why do we need more medications to treat lifestyle-based disease? What if the money that was spent on these expensive randomized controlled trials were instead spent on promoting lifestyles that reduce the incidence and the progression of fatty liver? Well, do we have evidence for those lifestyles? We sure do. Now, it's not, robust randomized controlled trials with thousands of people because those are expensive. And drug companies pay for those trials. Drug companies don't pay for lifestyle interventions. But we have a guide at dietdoctor.com called Fatty Liver Disease and Keto, 5 Things to Know. And it's actually not just keto, because there's evidence that low-carb diets, in addition to keto diets, benefit fatty liver. And it makes sense, because the fatty liver is really due to insulin resistance and overeating calories, overeating simple carbohydrates, including fructose, which goes straight to the liver, and having abdominal obesity. Type 2 diabetes makes it more likely. All of those things that I just mentioned are made better or avoided with low-carb diets and ketogenic diets. So again, it's one more reason why we should be focusing on low-carb diets as a specific intervention for people with fatty liver. Now, interestingly, a lot of people think, wait, fat in the liver, therefore you don't want to eat fat. Eating fat causes fatty liver. And there's even some studies, observational studies, saying that eating more saturated fat causes fatty liver. But here's the thing, those are in hypercaloric diets for people who are already metabolically unhealthy and eating high carb and high fat diets. So we can't say it's the saturated fats or the fats in general, we can say it's the lifestyle. But the exact opposite is shown if you're eating a low carb diet, high fat or not high fat. Just the low carb diet, regardless of how much fat you eat, decreases fatty liver. It helps with insulin resistance, it helps people lose weight around their abdomen, and it's reducing the fructose and the sugar overconsumption to begin with. So all of those factors can improve the outcome of fatty liver. And again, as I mentioned, the evidence isn't in huge trials, but there's an 8-week randomized controlled trial of 106 people that showed a reduction in liver fat and less abdominal fat. There's a combination of keto and a 5-2 fasting regimen that showed significant benefit. Another study reported almost a 50% improvement in liver function tests and liver markers of insulin resistance in patients with NAFLD who followed a low-carb diet. But here's the other thing. They don't just help with the lab tests. They don't just help with potentially progression of the fatty liver. They reverse the underlying process. They get rid of the underlying process. You're not just giving them a drug while they continue a lifestyle that could worsen their fatty liver and give them a drug to try and blunt that effect. No, you're getting to the root cause and erasing and avoiding the root cause to begin with by following this healthier lifestyle. I think that's where the focus really needs to be. So although, look, these scientists deserve recognition for what they're doing to try and point out the risks of fatty liver and to try and find ways to improve it and treat it. But that comes from the pharmacologic mindset. If people aren't going to change their lifestyle doesn't work, we need drugs to fix it. As opposed to maybe we're giving the wrong advice about the lifestyle. And if we revise that advice and be much more broader in what we consider proper lifestyle advice, now all of a sudden we can see a much different effect of people and the outcomes of fatty liver. So if you want to learn more, I encourage you to go to our guide at dietdoctor.com. We'll link to it below. But the keys are, look, fatty liver is a very dangerous condition. There's no question about it. But it's within our control. We can control it with the lifestyle we lead. We just have to break out of this fear that fat causes fatty liver. This teaching that all you have to do is eat low fat and reduce your calories and everything gets better. Because I think we've learned that doesn't work. We have plenty of evidence to show the way our health has gone as a country, as a world over the past few decades shows that doesn't help. And now we have evidence to show that low carb and keto diets can be a specific beneficial treatment for this condition. All right, if you thought this was helpful, please give us the thumbs up and click subscribe so you get more updates from us here at Diet Doctor News on YouTube. And of course, if you're using a diet to treat any condition, please consult with your physician first. If you need links to physicians who are more aware of low-carb diets and trained in low-carb therapeutic carbohydrate restriction, as we called it in our CME course, you can go to our Find a Doctor map also at dietdoctor.com. All right, take care, everybody.